Welcome to This Is What Democracy Sounds Like. I'm Kevin Prang. This program is a presentation of Metropolitan Congregations United. MCU is a community organization that brings together religious congregations, community groups, and individuals to work for common purpose to create a better life for all residents of the St. Louis region. We work at the intersection of race, economy, political power, gender, and the structures of oppression at work within us individually, within our organization, and within the community. We are working towards building people's control of the government, building community control of the economy, expanding the public sphere, and creating structural racial equity. Today, my guest is Mikel Whittier, the Coalition's Director for Healthcare for Missouri campaign, also known as Yes on 2. Today, we're going to talk about the latest developments in expanding Medicaid in Missouri as we approach the August 4th vote. Welcome, Mikel.
Thank you for having me, Kevin.
So if listeners have not heard yet, Amendment 2 is what we're talking about, and voters are being asked to expand Medicaid coverage to more people, and that's August 4th this year and not November. We want to reemphasize that. So Mikel, just as a refresher, what is Medicaid expansion and why has it taken a voter ballot initiative to try to expand Medicaid coverage in Missouri?
Well, Medicaid expansion is just that. It's expanding the criteria in which someone is eligible for Medicaid coverage in the state of Missouri. And so it has taken so long, primarily because of legislation. And our legislators in Jeff City couldn't quite agree upon a way in which we could expand Medicaid. And get services or access to care for many Missourians throughout the state.
So where does the origination for expanding Medicaid come from? What is sort of the history of how this idea or this policy has spread across the country?
So it has origins back to the early 2000s, actually. You see states like Maine who have tried to expand their programs. You've seen Medicaid waiver programs, meaning expanding eligibility criteria for a certain group. But then in the Patient Protection Affordable Care Act that passed in 2012, the federal government incentivized states to expand Medicaid coverage by way of the federal government covering 90% and states taking on 10% of those costs.
And how many states have taken advantage of this?
37 states now as of this week. So Oklahoma expanded Medicaid this past Tuesday.
And how did that come about? That seems like an unusual state to do that. And is there anything that we can apply towards our efforts here in Missouri?
Certainly. It's similar to what's going on in Missouri. You see a state like Oklahoma with just a lot of healthcare needs, economic needs, and the community spoke. They wanted to expand Medicaid. Ballot initiatives have been a way to get that done. And what we saw in Oklahoma was that the community members wanted to vote from rural areas to urban areas within Oklahoma. And so what we can learn in Missouri is how do we keep people safe so that they feel comfortable to vote during this unusual time? But then also, what key messages can we make Missourians aware of as we prepare to vote on August 4th?
Okay, great. And if Amendment 2 passes, what groups of people will gain coverage under this?
Certainly. So the sole focus of Yes on 2 is the workforce. And right now, in the state of Missouri, it is extremely difficult to get covered by Medicaid. And so there's a bunch of myths that this is a welfare program, sort of say. And the reality is the majority of people that are on Medicaid in the state of Missouri are those of us whom are disabled, children, refugee populations, and you have to make less than $3,700 a year in order to qualify for Medicaid. Again, I'm going to repeat that, $3,700 a year. And so it really allows us to address our workforce, our essential workers who are on the front lines for us right now, working in our grocery stores, providing services for us at organizations that make up to 18,000 or less than 18,000 annually. So it expands coverage just a bit. So those who are working, who are trying to work and really trying to do what they can for their families to get access to care. And so that's one thing we really want to focus on, is that this is not something that incentivizes people not to work. It actually does quite the opposite, which is expands coverage to those Missourians who are hardworking, who need access to healthcare and doesn't want to sacrifice paying a bill or something that is a priority to their family for their healthcare. And so we don't want to put our hardworking Missourians in those type of situations. And Yes on 2 will certainly get us going in the right direction to cover those hardworking Missourians who have been working so hard for us, especially during this time.
Okay. And so you mentioned the current cutoff was what again, 3,700, if I got that correct?
3,700 when talking specifically about income. The other eligibility requirements, again, are disabled, children, or if you're over the age of 65, et cetera. And so this really allows us to increase that. So you see up to $18,000 annually, but then also for families up to $30,000.
So currently, for those who fall in that gap, when and how do they access medical care, and what kind of pressure does that put on the rest of the healthcare system if they can't get it?
So this is actually, when you do access and when we expand Medicaid, what it does is allow opportunities for individuals in our communities to access regular care, which reduces the burdens of our emergency departments. It reduces inadequate use of our healthcare system. And so there is a lot of studies that have been done that shows that this really decreases ED utilization, emergency department utilization, and helps us extend care regularly to those who are now covered, which ultimately has some cost savers in it. Missouri Hospital Association has done research. Washington University in St. Louis has done research. And what it has demonstrated is this will have billions of dollars of cost savings for us by 2026.
So it becomes a preventative more than anything else then?
Yes.
So now that we're in the middle of our COVID-19 outbreak, how has this reinforced the need for Medicaid coverage in Missouri? And if we had already had sort of this Medicaid coverage, how would that have helped in this current crisis?
So specifically looking at our workforce and those who we're calling essential workers, this ensures that they have adequate access to health care. We are calling on our workforce in this time to address all of our needs, where our grocery stores are really backed up. You see some of our retail stores like Home Depot and Lowe's, Walmart, Target, where people are getting those essential products to homes in this time of need. But it really addresses those individuals who need help, who are really sacrificing their safety. They're sacrificing their mental health in some cases. So really just extending healthcare to those who have sacrificed so much for us so that we can remain safe in the state of Missouri. And just speaking from the St. Louis side as it pertains to COVID, we have actually done a great job over here. You see our hospital leaders, the COVID Regional Response Task Force, and the work that they have done to keep Missourians safe. We want to make sure we can continue to do that. We can extend healthcare to our workers who are on the front lines in the instance that anything like this ever happens again. And so again, it not only extends healthcare for the state, but it also has cost savings implications, which helps everyone in that instance.
Okay. And it seems like a lot of the workers we're talking about are those that work minimum wage, probably not full time. And so you're talking about working multiple jobs in order to get close to full-time wages, but still the lower on the pay scale.
Certainly. Our workers who are working minimum wage, our workers who are in between employment, especially at an economic time like this, those who are working in between jobs are trying to make up part-time jobs to be a resemblance of full-time employment, and try to establish a wage or a salary that's close to livable for themselves and their families. This really allows for them to get that access to the healthcare services that's so desperately needed, especially at a time like this.
Okay, is there anything kind of specific that is going to benefit a larger metropolitan area like St. Louis and St. Louis County and City?
Well, you see specifically jobs, the cost savings that come into the state, but then also the reimbursement for hospitals, healthcare organizations, et cetera, that comes into the state. We really can see economic growth in our metropolitan areas. So the studies that have been done has projected about 16,000 plus jobs annually, which about 40% of those go to the Kansas City, St. Louis, Springfield metropolitan areas, with the other 60% going to some of our rural communities throughout the state.
Speak a little bit more about the rural communities and the benefits. There are some real gaps in coverage in rural communities these days.
We have lost over the past decade or so 10 rural hospitals throughout the state. And so Yes on 2 will allow for those dollars to flow back into those communities through those healthcare organizations. It allows for rural hospital viability through Medicaid reimbursement. And not only that, you see those jobs coming back to rural communities, specifically within healthcare organizations, for example. And those are quality jobs as well. You're talking about projected 9 out of 10 of those are $15 an hour over the or right at about the livable wage. And so you're looking at not only economic growth, but access, but then also sustaining healthcare organizations, hospitals, with the potential to even reopen some of our hospitals down the road.
Okay. Now, a lot of people who are opposed to Medicaid expansion, I've seen this even this week, and I know we had even the Missouri legislature was trying to make budget decisions this week. They say that expanding Medicaid is going to put a strain on the budget. With taxes down right now, will expanding Medicaid actually do that? And where does the money come from for Medicaid expansion?
So it's actually quite the opposite. Again, Washington University conducted a study where we see $1 billion in cost savings by 2026. And these are taxes that are going to the federal government already. And so we are currently being taxed. And so now that money will go to not only 36 states, but now 37 states who have expanded Medicaid, including now Oklahoma this past week. And so these are dollars that we are already having leave our pockets, leave our state, that never returns. And so how it is paid for, the federal government covers 90%. And so when you look at, for instance, you look at women's health, and a woman who's covered, who's getting a breast examination or whatever the case may be, the state is required to cover 35% of that. Well, with Medicaid expansion, the state will cover 10% of that, with the federal government covering the other 90%. And so that's just one example of how we can potentially move towards cost savings in the state of Missouri.
So it's really just bringing dollars back that are already leaving.
Certainly bringing dollars back.
And do you have a comparison? I know that there are a couple of other states that passed Medicaid expansion by voter initiative also, and I think like Nebraska was one of them and things along those lines. Is there a comparison to how those states have been doing compared to where Missouri's at?
Yeah, so you take Michigan, for example. They were able to return billions of dollars back to their state, 800 in local revenues, and they also saved more than $1 billion on mental health programs. And in Missouri, as we know, we have a huge problem with opioids and mental health and behavioral health. And that's a topic that gets lost in the shuffle a bit here with COVID and a lot of the other issues. You see that Arkansas, for example, produced a net saving of more than $400 million in the last 3 fiscal years alone. So those are just examples specifically of how we can show cost savings, but then the potential that a state like Missouri has with expanding Medicaid.
Okay. Now, originally there was some thought that this would be on the November ballot. And I want to remind folks, we're voting this on August 4th. So circle
August
that
4th.
on your calendar. How had that decision changed how the campaign works and how we're getting the messaging out right now?
Well, certainly in a shift, it accelerates messaging. It accelerates raising awareness, and really that's been it. We haven't had to deviate much, and the only thing is how do we get our communities the information they need to make informed decisions. We want people to understand the information, the evidence and data that is there. We don't want it to be a partisan decision. Yes on 2 is a nonpartisan campaign made up of healthcare professionals, doctors, nurses, advocates who understand why we need access to care throughout the state of Missouri. And so really, we want to get as much information to our hardworking Missourians as best as possible, as fast as possible. And so that's really the only change that we've seen. Okay. And one of the surprising turn of events was the Missouri Chamber of Commerce endorsed Amendment 2, and they're not an organization that typically endorses projects like this. What was the reasoning that they had for coming out in favor of Amendment 2? Well, specifically, it's the economic growth. As I mentioned, the evidence is there, the data is there. The other states before us have laid out examples for which Missouri can replicate the cost savings that has been seen in those states. And so at a time like this, bringing back billions of our dollars from Washington, D.C. is extremely important. The chamber saw that. I'm sure they made a difficult decision to the points that you raised, Kevin. And so it just shows why this is needed. It's so desperately needed. The jobs, access to care. In addition to, we see budget constraints already in the state of Missouri where we've had to cut education, infrastructure, and other parts of the budget. This allows for us not to do that. And we really can make fiscally responsible decisions with the budget, invest in education, infrastructure, and other things that the state needs. And so this is an avenue or a vehicle in which we can do that.
So with the COVID pandemic still a threat and our continued social distancing as part of our lives, what's your message for voters and how they should prepare for the August 4th election?
Well, certainly first, protect yourselves and your families. We know it's seen in states who have demonstrated hotspots within our own state with our community members down in the southwest areas of the state, that COVID is still in our communities. And so practice proper social distancing, wear face masks if going to the polls. If you are a high-risk individual, you can also request an absentee or mail-in ballot. They are not the same. And so I do want to make that clear. Absentee and mail-in ballots are not the same. If you request a mail-in ballot and you're not over the age of 65, you do have to get that notarized. And your local banks and other places, and even groups and communities are working on ensuring our community members have access to notaries. However, we do want to make sure that people are safe. I think that's the utmost importance. But it's our responsibility to practice our constitutional right to vote. And so whatever makes sense for you, your family, please do so. In addition to that, July 8th is the last day to register to vote. So we have less than 5 days to register to vote. So that'll be the first step. Get registered, get involved, understand the issues that are on your ballots, and yes on two.
It's pretty simple there.
Yeah.
So are there any other ways that listeners can help the campaign? How do they get involved?
Certainly. First, you can start with yesonto.org. There's a ton of information there where you can endorse, get involved. If you text CARE, CARE, to 21333, that's 3 threes, so 21333. You'll get updates and information about events, canvases, and then you have text banking, phone banks, where you, a group of friends, your organization can call our fellow Missourians to make them aware of Yes on Two, the specific information and evidence that really we've spoke about today, and the value that's there for all Missourians throughout the state, from our rural communities to our suburban and urban cores. And so we really just want to get that information out. And so however you get involved, there are ways for everyone throughout the state to do that.
Okay, excellent. And one of the things MCU is encouraging is just start with the basics too, of send an email to your family and friends. Start with the people you know. It can be as simple as that sometimes.
Yeah, and we have an initiative that we're calling Text 10, where you text 10 of your friends, those friends text 10 of their friends, and so on and so on. And that's really what we call relational organizing, where just spreading the word through our friends and families and colleagues is so valuable, especially when dispelling myths about particular things on the ballot. and this is one of them, a topic that has been controversial without a doubt. However, I can't say it enough, Kevin. This is nonpartisan. There's so much value for our state economically and through healthcare access that could really change and shift our state for the better for years to come.
Okay, great. Thank you, Mikel, for your time today.
Thank you for having me, Kevin.
All
I
right.
really appreciate it.
I want to thank our guest, Mikel Whittier, from the Coalition. He's the Coalition's Director for Healthcare for Missouri campaign, also known as Yes on 2. To learn more about MCU, go to the Metropolitan Congregation's website at mcustlewis.org. Also, be sure to follow us on Facebook, Twitter, and Instagram, and we'll have links to more Yes on 2 information. And if you want to participate with us specifically, you'll find the details there on our website and our social media outlets. I'm Kevin Prang, and you have been listening to This Is What Democracy Sounds Like. Tune in again next time, and we thank you for listening.